Hi everyone, welcome back to my YouTube channel. Today we are going to talk about ethmoid bone. Here at the side you can see the diagrammatic representation of ethmoid bone. So let's start the topic with the introduction. It is situated in the midline of face. The ethmoid bone lies below the two orbits and form critical part of nasal cavity as well as cranial floor. Due to its porous sieve-like structure and multiple articulation with adjacent bones, ethmoid bone is integral to ventilation, olfaction, and overall balance of skull. A comprehensive understanding of this bone is fundamental for fields such as otolaryngology, neurosurgery, and radiology. Now let's talk about location and articulation of ethmoid bone. Ethmoid bone is found at the anterior cranial fossa nestled between the frontal bone superiorly and maxillary and nasal bone inferiorly. It contributes to the medial wall of each orbit and forms a significant part of nasal septum. Its central position gives it a pivotal role in defining the contour of the face and structure of nasal passages. Now let's talk about parts of ethmoid bone. It includes cribriform plate, as you can see here in the diagram. The upper red portion, thus the side plates are cribriform plate that are the horizontal sieve-like structure form the roof of the nasal cavity and provide passage for olfactory nerve. These are tiny perforations in the cribriform plate that allow the filaments of the olfactory nerve to traverse, linking the nasal mucosa with the olfactory bulb located on the brain's inferior surface. Further talking about its part, it has perpendicular plate that extend vertically downward from cribriform plate, and the perpendicular plate contributes to the formation of nasal septum. As you can see here in the diagram, this part of the ethmoid bone is perpendicular plate. It ensures the separation of left and right nasal cavities and provides structural support. Next part of ethmoid bone is ethmoid labyrinth. That are lateral to the perpendicular plate and cribriform plate, it lies the ethmoid labyrinth that are composed of maze of thin-walled, air-filled cells that are known as ethmoidal sinuses. These cells are variable in number and size among individuals and play a role in reducing the weight of skull and resonating the voice. And you can see here in the diagram, the blue color area is basically an ethmoidal labyrinth. Further talking about spot, it has superior and medial nasal conchae. They are formed as a part of ethmoid bone. These curved bony structures project into the nasal cavity. They are critical for directing airflow, warming, and humidifying inspired air and increasing the surface area for olfactory receptors. Now let's talk about embryological origin of ethmoid bone. Ethmoid bone develops through the intramembranous ossification, and during early embryonic life, mesenchymal tissue in the nascent facial region differentiate and directly transform into bone without a prior cartilage model. This rapid ossification process is key to forming a thin, intricate architecture of the ethmoid bone. Now let's talk about postnatal growth and maturation of ethmoid bone. Unlike many other cranial bones, they continue to remodel over several years. Ethmoid bone delicate structure reaches maturity relatively early. However, its sinus cavity can exhibit modification in size and mimetization throughout the life. The delicate lamina that compose the ethmoidal labyrinth continue to maintain their complex sieve-like configuration well into adulthood. Now let's talk about functional significance of ethmoid bone. The first functional significance is they support and give structure of the nasal cavity. Ethmoid bone contributes significantly to bony framework of nasal cavity. The perpendicular plate forms the superior aspect of nasal septum, ensuring proper partition of the airflow. In addition, its nasal conchae are key in regulating the air passage through the nasal cavity, assisting in process of warming, humidifying, and filtering inhaled air. Next significance is its role in olfaction. Cribriform plate of ethmoid bone is essential for sense of smell. The perforation in this structure allows olfactory nerve fiber to pass from the nasal mucosa to the olfactory bulb. Any pathological alteration in this region can directly impact olfactory function, making the ethmoid bone central to sensory perception. Next significance is contribution to craniofacial integrity. Beyond respiratory and sensory roles, the ethmoid bone play a part in stabilizing medial wall of the orbits. Its connection with the frontal sphenoid nasal maxillary bone help maintain the overall structural harmony of the skull and contributing to both aesthetic and functional aspects of face. Next, we will talk about clinical significance. as it has susceptibility to trauma and fracture. Given its delicate sponge-like quality, the ethmoid bone is particularly vulnerable to fracture, especially from blunt force trauma to the mid-phase. Fractures of ethmoid bone may comprise the cribriform plate, potentially leading to CSF leakage and increased risk of infections such as meningitis. Next clinical significance is sinusitis and inflammatory condition. As the ethmoidal sinus cells are common site for sinus infection, inflammation or blockage of these cells can lead to ethmoidal sinusitis. That is a painful condition that may extend to adjacent orbital or intracranial structures. Radiological imaging play a vital role in diagnosing and managing such infection. Next significance is implication in surgical approaches. As the complex anatomy of ethmoid bone requires careful consideration during surgical intervention, particularly in endoscopic sinus surgery. Surgeons must navigate the narrow corridors of the ethmoidal labyrinth to avoid damaging the cribriform plate or nearby neurovascular structures. Advancing is imaging and surgical navigation have improved the safety of procedure in this region. Now let's talk about the conclusion of whole this lecture video. Ethmoid bone with its intricate lattice of plates and sinuses is a small yet mighty component of cranial and facial skeleton. Its essential function is supporting the nasal cavity, facilitating olfaction, and contributing to overall integrity of skull underscore its importance to both normal physiology and clinical pathology. Detailed knowledge of its anatomy, development, and functional role is indispensable for healthcare professionals, particularly those specializing in craniofacial surgery, otolaryngology, and neurology. And this was all about smartphone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.